Hi guys, welcome back to my YouTube channel. I'm OOA. If you're just joining the club, you're welcome. Don't forget to click on the subscribe button on your right and subscribe to my YouTube channel, and click on the bell to get notifications whenever I upload a new video. So today we'll be talking about an interesting topic that is so common in our environment. But quick question, do you know that the word miscarriage is the same thing as the word abortion? Yeah, that may sound different, but yes, it's the same thing. I know some people will say, no, how can miscarriage be the same thing as abortion? Well, we tend to have this belief because of our environment, but truth be told, miscarriage is the same thing as abortion. So today I'll be explaining what miscarriage is, which is the same thing as abortion, and I'll be explaining the differences as well, and talking about the types of abortion and the risk factors and causes. You guys should sit down and enjoy the discussion. So what's miscarriage? Miscarriage, also known as abortion, can be defined as extraction or the expulsion of the fetus and other products of conception from the uterus before the age of viability, which is 28 weeks. In case you don't know the meaning of age of viability, it means the gestational age at which 50% of fetus can survive outside the uterus. And as I said earlier, it is 28 weeks in Nigeria, 20 weeks in the US, 24 weeks in the UK, and 22 weeks according to the WHO. Yes, as I said earlier, I said miscarriage is also known as abortion. Yeah, but they can be classified into two, which includes the spontaneous abortion and the induced abortion. The induced abortion is the one we all know to be done illegally in some countries and legally in some countries, while the spontaneous abortion is what we know as miscarriage in the whole world. So what's spontaneous abortion? Spontaneous abortion can be differentiated from induced abortion with the use of the word expulsion. Yeah, it is said to be a spontaneous abortion when we use the word expulsion, and it is said to be an induced abortion when we use the word extraction. So what is spontaneous abortion? It is the expulsion of the fetus and the products of conception from the uterus before the age of viability, while induced abortion is the extraction of the fetus and the product of conception from the uterus before the age of viability. The induced abortion could be instrumental, but spontaneous abortion is not usually instrumental. Instead, it occurs on its own and is just spontaneous. So that is the major difference between spontaneous and induced abortion. Spontaneous involves the fetus being expelled from the uterus on its own, while induced abortion is the extraction of the fetus from the uterus, and which is most times instrumental, and it is the illegal abortion we all know. So let's talk about spontaneous abortion. Spontaneous abortion can be classified into different types. This includes threatened abortion, inevitable, incomplete, complete, demissed, and it can be also deceptive. One thing we should know is that there is a common feature amongst these different types of spontaneous abortion, and which is history of amenorrhea. Any woman that experiences any type of this abortion must definitely have an history of amenorrhea. So let's talk about the very first type of miscarriage, which is the threatened miscarriage. The common features that are seen in this type of miscarriage includes: number one, positive history of amenorrhea. There is a positive history of slight or no bleeding, positive history of slight or no abdominal pain, and the uterine size is always appropriate, while the cervical os is usually closed. Inevitable miscarriage, there is a positive history of presence of bleeding, abdominal pain, and the presence of a dilated cervical os, as well as an appropriate uterine size. While in incomplete abortion, there is presence of heavy bleeding, presence of abdominal pain, and there is presence of leftover products of conception with a dilated cervical os. In complete abortion, there is absence of bleeding, abdominal pain, and there is no presence of products of conception. The uterus contracts and it returns back to its normal size, and there is a closed cervical os. In missed abortion, there is presence of fetal pulse but absent fetal heart rate, and in this case, the uterus fails to contract to expel the product of conception, including the dead fetus, and this time women tend to experience absence of bleeding, absence of abdominal pain with a closed cervical hold. Also, we have what we call the recurrent miscarriage, and in this case there is occurrence of 2 to 3 or more consecutive spontaneous abortion of pregnancies from the same biological father. Common risk factors and causes of this includes increasing maternal age, infection, endocrine disorder, fetal anomalies, cervical incompetence, uterine anomalies, as well as fibroid and so many other causes. So how do we manage a spontaneous abortion? Number one, you have to put them on bed rest, and also reassure them that everything will be fine. Then if it is a pregnancy of less than 12 weeks, in case of an inevitable abortion, you have to do a manual vacuum aspiration to expel the other products of conception. But if it is a pregnancy that is more than 14 weeks, you can just administer oxytocin like oxytocin, so that the uterus can contract on its own and expel the other products of conception, so it doesn't harm the patient. Now let's talk about the induced abortion. The induced abortion is the one we all know to be illegal. In my country, it is illegal except in cases where the pregnancy is posing a harm to the patient. That's when we see it as a legal procedure. And as I defined it earlier, don't forget the word extraction. It is the extraction of the fetus and products of conception from the uterus before the age of viability, which is 28 weeks in my country, unlike other countries which is 20 weeks, for example in the US, 24 weeks in the UK, and 22 weeks according to the WHO. Induced abortion could be safe or unsafe. It's said to be unsafe when it is done by an unskilled personnel, or when it is done in an environment that is not favorable. That is when we say it is unsafe. But it is safe when it is done by a skilled personnel in an environment that is favorable. Abortion could be done in different ways, in two major ways, which includes the surgical method and the medical method. These days, induced abortion has been made safer by introducing the MVA, which stands for the manual vacuum aspiration, which just involves the use of pressure to extract the fetus and other products of conception, unlike back in the days when they do the dilation and the curettage, which led to the perforation of so many uterus and led to the death of so many women. So what are the complications of unsafe abortion? The complications could be immediate and it could be on a long term. For the immediate complications, this includes infection, it includes hemorrhage, it includes trauma, as well as kidney failure. While on the long term, it could lead to chronic pelvic inflammatory disease, it could lead to chronic pelvic pain, it could lead to secondary infertility and ectopic pregnancy, and so many other complications. And that's why I'm saying this. Do you really think abortion should be legalized or not? Because I feel these complications could be avoided if abortion is legalized. Other complications include cervical incompetence and Asherman syndrome. Okay, of all things I've been talking about, the most important aspect is the post-abortion care, and this is the care any woman receives after undergoing abortion. So some few care, like emergency care, that is to be given to any woman that undergoes an abortion, includes correction of anemia. Also, you have to place her on antibiotics, you have to give her the tetanus vaccine. Also, we need to prevent rhesus immunization. Other care to be given includes counsel on family planning services. We also need to screen them for any form of STI and also start treatment immediately. They also have to screen for any form of cervical lesion as well. So guys, I believe with this I've been able to tell you why miscarriage is the same thing as abortion, and I believe I've been able to explain the types of abortion, which is the spontaneous and the induced and other subtypes of spontaneous abortion. So don't forget to answer my question. Do you think abortion should be legalized in countries that they are not? And if you feel it shouldn't be, just give me an answer in the comment section. Or if you feel it should be, you can also give me an answer in the comment section. I'll be gladly replying. Don't forget to subscribe, like, and share this video, and also comment too. Till next time guys, bye.